Welcome to this episode of My VA Disability Claim. Hey, today we got breaking news, right? Breaking news. A new study recently came out that's linking burn pit exposure to mental health conditions, all right? So if you were exposed to burn pits and you're having mental health concerns, make sure you get that medical help that you need, all right? Because this report came out July 22nd of 2025. You'll see the date up here. I'll put the picture up here for you. I'll put the report up here for you as well, at least the article talking about it. Came out July 22nd, 2025, right? Here we go. We just read a little bit of it. A new study has found that exposure to military burn pits increases the risk of mental health conditions and brain injuries. A finding researchers say could lead to better understanding of those conditions in veterans, mental health conditions, and brain injuries, right? The study, conducted by various universities, including the Brown School of Public Health and Harvard Injury Control Research Center and Department of Veterans Affairs, epidemiologists examined the medical records and deployment data of nearly 440,000 Army and Air Force members. Okay, good amount. Who deployed from 2001 to 2011. That's that time period. Yeah, 2001 to 2000, those 10 years right there. A lot of exposure. The researchers found that service members who deployed to bases with large burn pits had higher rates of anxiety and post-traumatic stress disorder, and also higher rates of brain damage and injury-related deaths. According to the data, nearly 29% of service members diagnosed with severe stress had spent at least 130 days at a base with a burn, that's only 4 months, at a base with a burn pit, compared to roughly 13% who were diagnosed but served at a base that did not burn its trash. Personnel were twice as likely to be diagnosed with anxiety if they spent at least 4 months at a base with a burn pit than those who served at cleaner installations. So they're saying that there's some correlation, maybe not causation, but definitely correlation between being stationed at burn pits and then having mental health conditions down the road. So we want to say, make sure that if you're experiencing these mental health, definitely make sure you get it service connected so you can get the medical support coverage that you need, right? Make sure you get it service connected. Why do I say make sure? Because the unfortunate reality is that if a veteran does not get their mental health service connected, and the cause of death for that veteran ends up being suicide, the benefits for their surviving family members may be compromised, right? As a person who's hundreds of survivors that I've sat face to face with to talk about, how we're going to proceed to make sure they can get, that support going forward. It's difficult if the death certificate doesn't have what needs to be on there. And what needs to be on there, simply put, is a service-connected disability, right? But as you're going through the passing of someone, it's really tough to focus on things that are trivial in those moments, right? But they become big, down the line. So it was always try to stress making sure your things are service-connected. If you're dealing with these things, make sure they're service-connected. When you talk about a veteran, you're not just talking about one person. Veterans are connected to family members, and those family members are connected to the veteran's benefits, right? Like, that's the reality of it. So we always suggest make sure you get service connected for your medical conditions so that even after we're gone, we can still contribute to our families, right? Like for me, when I die, I want to be able to still contribute to my family and to people in general. That's kind of what this channel is about, right? To be able to.
Do you think the VA claims process can be difficult, stressful, or even chaotic at times? If so, we made the Before You File guidebook to help you keep your claim simple and organized. The VA claims process can make you feel overwhelmed, frustrated, or even pissed off. So we made the Before You File micro learning course to help you feel comfortable and confident when you walk into that office to file your VA claim. Get the products and enjoy the benefits. Now back to the show.
Contribute. So much has been given to me. I feel like, hey, I have to contribute. I have to contribute. And I'm sure most veterans want to do that. Even after I'm gone, I still want to make sure, my family's good, right? The people who are a part of this unit I built, I want to make sure they're good and still have my support. So that's why we say it's important to make sure, get your conditions service connected. So let's read a little bit more of the article. And of the 979 troops in the study who died by suicide using a firearm, 90% had served on a base with a large burn pit for 129 days or more. 90%. That is significant. The researchers theorized that the hazardous materials released by the burn pits, which were used to dispose of garbage, medical waste, plastics, batteries, office equipment, tires, ammunition, and other items, can disrupt endocrine and immune function, accumulate in the brain, or disrupt neurotransmitters and contribute to brain inflammation. Oh man, yeah, that's all bad. We have essentially this cocktail of various hazardous exposures, which include a lot of carcinogens. We know they could really impact areas of the brain that are strongly associated with mental health. Christian Hoover, a National Institutes of Health Research Fellow at Brown University, said, the research points to an association between burn pits and mental health conditions, but does not show that the burn pits cause the disorders. Okay, so now it's causation and correlation. It's showing correlation, but maybe not causation. But the study, indicates a link between cumulative exposure and mental health conditions. The genesis of the project was essentially the idea that environmental exposures could influence mental health. I think they're kind of proving that. So again, make sure if you have these conditions, make sure you get them service connected so you can get that medical coverage and support that you need, right? And you can make sure that your surviving family members will be supported as well. Military.com, great site also, great. I recommend reading this article. There's different studies as well on there. It's great for searching for those state-specific benefits also. I mean, military.com, probably my favorite military-based site out there, including mine, right? It's probably my favorite, but so look into it. Definitely say look into it to get more information on it. If you know someone who's dealing with this, veteran, dependent, whatever the case, hey, make sure you get the support you need. Try to get the support. Connect with the VSO in your area, right? You can Google that, but definitely get the support that you need, all right? And that's it. As always, learn the information, Use the information. Share the information. Have an incredible day, baby. Hey, yeah.